Good afternoon, and welcome to the Flint Community Webinar on Coronavirus. This is week 73, August 6, 2021. Who knew that we would be in this conversation for this many weeks, but we're excited that you joined us today for this webinar. This webinar is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I am excited to have the opportunity today to be your moderator. My name is Yvonne Lewis, and I am the co-director for the community core of the Healthy Flint Research Coordinating Center. We have an extraordinary program for today, so I trust that you will all be prepared. Please take out a pencil and piece of paper. Be ready to take some notes from today's session. We want to let you know, for those of you that are listening in, maybe you are not able to join us actually in the webinar, but we have a number of community partners that have joined us for these 73 weeks who are here as panelists to answer questions for you today. So please be sure to put your questions in the Q&A. If you are joining us and you are by phone or YouTube and you want to send us a message, you can do that by going to info@hfrcc.org, info@hfrcc.org, and send those questions in, or feel free to call us at 810-835-2130. Again, that number is 810-835-2130, and share your questions there. Just want to highlight some of the partners that are on today that will be able to answer calls for you. Of course, in the background, we have representatives from the Greater Flint Health Coalition. Of course, the University of Michigan, Flint and Ann Arbor are here to answer questions for you, along with Michigan State University. We have doctors on the call. I want to shout out to Dr. Jennifer Edwards-Johnson, who also is available to answer questions for you. You'll be hearing from some of our panelists today, as you can see here on our flyer that was sent out to you this week. Our topics today are going to be healthcare coverage enrollment. We'll have a medical moment and an update from the governor's office. We'll also hear from the city of Flint and an update from the Genesee County Health Department. Our representatives that'll be on the panel today are Lottie Ferguson, Dr. Susan Wolford, Jim Melanowski, Mary Catherine Crawford, Dr. Lawrence Riddle, Gary Jones, Dr. Perry Hackert, and Sherelle Brown. They're going to provide some really important information to you. So I hope that you will just be ready to take these notes today. As we prepare to get into our conversation today, I wanted to remind you that our goal for this webinar was to provide some local context to the global pandemic. And I've had the question asked to me, so Yvonne, why are we addressing things like healthcare? Why are we talking about mental health? Because we recognize that in the midst of this pandemic, all of these things are important to us. It's necessary for us to understand that health is more than the absence of disease. We talk about social determinants, those other factors that affect our overall health and well-being that we want to be mindful of. So today, and as we go forward in the future, based upon many of your requests, we'll be bringing information to you that will help address the issues that affect us in our community as a result, in addition to the coronavirus. So today, our panelists are here. I'm going to ask Brother Gary Jones if he would come forward. Gary is a community affairs director for Flint, specifically out of the governor's office, always has tremendous updates for us. So Gary, please share with us what's new or what's been happening this past week out of the governor's office.
Thank you, Yvonne. Appreciate it. Good afternoon, everyone. So earlier this week, Governor Whitmer led a roundtable discussion in Flint with local and state law enforcement officials, community leaders, and elected officials to address public safety and put Michigan safety first. Governor Whitmer sent a letter last month to U.S. Attorney General Merrick Garland urging support for Michigan State Police's application for a federal grant, which is funding that will come through the United States Department of Justice's Community Policing Development De-escalation Training Program to put safety first for our troopers and for the communities they serve. The governor has also supported $1.4 billion in her budget recommendation for local governments, which supports police, fire, and public safety, and created incentive programs to help communities hire and retain officers who live where they work. The governor also signed several Senate bills recently, which will extend the validation of state driver's licenses. and personal identification cards. The Senate bills will extend the period for which an operator's or chauffeur's license is valid, extend the period for which an enhanced driver's license or enhanced state personal ID card is valid. The governor and both the Michigan Community Service Commission announced Michigan's $24.5 million AmeriCorps investment that will support over 1,000 AmeriCorps members, tackling some of the state's toughest issues, including COVID-19 recovery, disaster services, economic opportunity, environmental stewardship, education, health, and safer communities. This investment will support 26 Michigan organizations through grants to expand their reach and impact in Michigan communities. 2 Genesee County organizations include Crim Fitness Foundation and the United Way of Genesee County. The state of Michigan has submitted comments to the Centers for Medicare and Medicaid Services, expressing support for proposed rule changes that will protect and expand Michiganders' access to high-quality, affordable health insurance. Open enrollment on the health insurance marketplace normally runs from November 1 through December 15th each and every year, with coverage starting January 1 of the following year. Under the proposed CMS rule changes, the yearly open enrollment period will be extended through January 15th, giving consumers an additional 30 days in which to obtain health coverage. The governor also recently announced plans to make an historical housing that addresses the health, safety, and well-being of Michigan residents and communities grappling with unique and varied housing needs. The proposal would assist 6,000 Michiganders, produce 2,000 rental housing units, and leverage an additional $380 million in private funding while creating 1,600 good-paying jobs. Special thanks to Communities First Incorporated for hosting the governor last week at Coolidge Park Apartments in Flint to help elevate the importance of this historic investment in affordable housing. And lastly, Governor Whitmer joined the Michigan Economic Development Corporation to announce that a new co-op urban grocery store will soon be coming to the north side of Flint with support from the Michigan Strategic Fund, intended to provide much needed, affordable, healthy food options to area residents. The project will revitalize a long vacant building and help address health issues in the documented food desert of North Flint. And lastly, Michigan.gov/COVID vaccine and Michigan.gov/coronavirus, of course, are still the best catch-all websites to keep updated with everything.
Thank you so much, Gary. And you pointed out a couple of things that we talked about, those other determinants of health. And you pointed out affordable housing. You pointed out food, and that one section of our community, we think about it for the longest. We haven't had a full line grocery store over in the north end of Flint. So it's important to us to see these investments that the state is willing to make in our community. So thank you for that, Gary. Thank you so much. So as we segue into the next place, we're going to have a bit of a roundtable right now. Just wanted to emphasize a couple of other points. When we started this webinar in March of 2020, we had no understanding or very little understanding about the coronavirus. We went to some understanding. We started talking about safety protocols, those things that we could do before we found out if there was a treatment, because initially there was no treatment. So we're washing our hands, we're being told to wear masks and so forth, and we're trying to follow those protocols. Then we have testing that came available, and everybody was wondering where to go to get tested. We were able to share that information. Vaccines then became available at small numbers, and now we have vaccines all of our community. And we did see a decrease, but yet now we're seeing a rise again. So I'm going to ask Dr. Hacker, Dr. Reynolds, and Dr. Wolford, and Dr. EJ, you may even want to join us in this conversation today. But Dr. Hacker, I want to just start with you as our health officer. You just made a really important statement the other day because there's been a release in some of the mandates as a result of some concerns about political issues, as well as just people getting frustrated of wearing masks. But as we see the Delta variant arising, what is your role as a health officer? Educate, protect, inform, and at some point enforce. Tell us how important that is with this conversation around the masking.
Well, this particular community conversation is critical, and I would just like to give a shout out to all who participate with this, because looking at our Michigan Safe Start map, I'm trying to copy that in there. Let me see if I can put it in so people maybe follow along on here. I think it's remarkable, and I'm proud to be a member of the community, because if you can click on that and look at it, this is the Michigan Safe Start map. The CDC changed their transmission indicators. I don't know, time's so relative right now. It's about a week ago. And we had been in the state using A through E, A being low and there's no risk or no cases. And then the CDC switched to low, moderate, substantial, and high. And then with their messaging that they had come out with last week saying, we urge everyone who's vaccinated or unvaccinated because of the Delta variant to wear a mask in indoor places when transmission is substantial or high. And if people have been able to pull that up, you can see here at the top, it says CD transmission indicators, or it may say Michigan Start Map risk levels. And then it gives you convert between the two different ones. It's a drop down, so you can go to either one and get what we are. But really, I think so much of this is owed to you and to the community work that has been done, because we are still at moderate level. And if you look at the surrounding counties, with the exception of Lapeer, all the surrounding counties are now at the substantial level. And that the reason I want to bring that up first is because there are two things that I can do as the health officer for the county. And I can give directives, I can give strong recommendations, and that's just what it means. It just means a strong recommendation. It's a little more formal than if I came on here and said, hey, everyone should wear masks, because it's going to be written out, and the guidelines are written out as to who and when and why. And that is what I put out a couple of days ago. And then the other one, and that's a proactive type of engagement with the community. Looks a little more formal, but it is proactive, because we have had a lot of, on both sides, wear masks, don't wear masks. And the difference between this and a health order is that an order is actually enforceable. And I think orders need to be in response to a specific threat. If we have transmission that we see just going wild through the community back, like say when it was up in the 300 cases per day, that is very strong. That's the kind of thing where you would want to take a stronger order and put out. As it is, my orders are going to be used for specific exposures or cases if people aren't cooperating with the health department guidelines of, yes, you should be in isolation or you should be in quarantine. The way I personally remember isolation is for ill people. They both start with I. And so that's still the 10 days, even with the Delta variant. The quarantine, which is when people have been exposed, is actually going to be 14 days now with the Delta variant. There's been some evidence that Delta variant can go up to an 18-day incubation period, but it is still recommended now at the CDC to do the 14 days and not be able to test out unless you've been fully vaccinated and exposed. So if you're fully vaccinated, exposed, let's say you went to an international location, or say the middle of our country right now, which is a hotbed of transmission, you would be asked to, if you're fully vaccinated, be asked to wear a mask, still carry on your business, but wear a mask at all times when you're outside of your own home, and test 3 to 5 days after returning, because by then a PCR test would usually show that up. So my directives, we can go into that in more detail, but that's really what I wanted to say right now, is that the information I put out earlier is a directive, strong recommendations, hoping to never get into, certainly not get into the high area, and so impressed we're not in the substantial transmission as our other counties have changed around us this week.
Thank you, Dr. Hackett. And I saw Dr. Reynolds nodding, and he's got a smile because he just gave you the real thumbs up on this. But Doc, you also mentioned, we talked about the masking. You said that masking and vaccines is just one effort in a whole string of things. You talked to us a few months ago, actually, about the Swiss cheese model, and that was something that you and Dr. Deborah talked about. So I want to ask you to just to emphasize that again, and then I want to just quickly switch to Dr. EJ and Dr. Wolford to talk about it from the hospital perspective. Dr. Reynolds. Can you come off mute, Doc? We don't want to miss anything you're saying.
Thank you. I really appreciate our health department director stepping out and being clear and putting it in writing so that it's disseminated widely instead of, as some places have done, till the last minute and we have a disaster on our hands. And as I've said before, as a pediatrician, this is near and dear to my heart because kids are going back to school, right, Dr. Walford? And all you parents and grandparents out there. So it makes sense. And we talk about science, and science is a series of hypotheses that are proven or disproven, updated, and modified. So we have to be prepared to update our information at all times. And then I go to the admonition of my mom when I would do something stupid, and she would say, just because you saw your friends jump off the bridge, does that mean you're going to jump off the bridge after them? And I think I finally learned the lesson. I don't have to do what people around me do. I have to do the best thing and the thing that reduces and gives me the most protection. That's why I have a car with brakes. I wear my seatbelt, and I have a car with an airbag. And that goes to our other part of it is the Swiss cheese. And I'll ask Dr. Wolford to forgive me for stepping into the kitchen. I wish I had but vaccination is the fundamental first layer of our protection against getting COVID-19. People may say it's not 100% effective, but nothing is 100% ineffective. Okay, so then the next layer is if we come in contact with someone, we go into quarantine or isolation if we actually get infected. As Dr. Hackett has said, that is a layer of protection. The other layer of protection, which Dr. Hackett has done once again, is clear communication and effective messaging because it reduces the confusion. But it also provides us a layer where we can act effectively and intelligently. And then there's contact tracing. But then we also have in our built environment, we do have to address ventilation and doing as many things outdoors as possible. And might I add, social distancing with that, because if you go into a place that's crowded and no one's masked up, that would cause me to back up. I had my own mask. And so the next layer would be avoid touching your face. And boy, that is a challenge. Wearing glasses does help, and wearing a mask helps even more when we're inside a shared public space. But then hand hygiene and wearing a mask are also important. And each layer of this protection increases our protection, decreases our risk, and combined, working together, it decreases our risk of infection. So please, don't abandon any of these layers and appreciate those things that are provided within our community, within our city, within our county, in our schools. And let's cooperate and remember those layers of protection. Thank you.
Thank you, Dr. Reynolds. And again, I saw Dr. EJ, you're just nodding and you have your mask on and you're in the hospital. So Dr. EJ from the hospital, and she has her hand sanitizer. So Dr. EJ, this masking thing is really, really critical right now because it is one of the most important things that we can do. Why over the nose and the mouth? Because I see you got it all the way up there, but anything else you want to share about the importance of masking, even in, especially in the hospital setting?
I think the importance of, I think Dr. Reynolds alluded to it, right? Is we're using all of the layers of protection that we can. And you see me wearing my mask in the office just in case someone comes to grab me for a quick question or wants to knock on my door and ask me a quick question. Basically, I'm wearing my mask unless it's really clear that I'm going to be eating lunch and I'm not to be disturbed or don't want anyone coming in. But wearing a mask over the nose and the mouth is important because we breathe out of our nose, and that's an area where the virus can live, and it's an area where we can transmit the virus. So we like to keep it over our nose and our mouth because these are places from which we can commonly spread the virus. So I think we're just using all of those layers of protection. Every time I take my mask off, I wash my hands with the hand sanitizer that's next to me, or I go, out and wash my hands really close by. But I think the second layer that's important is we talked about vaccinations. And I think it's important to think about who we might be around that might not be able to be vaccinated. And I think, that's an important context, particularly as we think about Dr. Wolford and we think about kids going back to school. We have a whole population that's 12 and under who can't be vaccinated yet. And so wearing masks, having them wear a mask, having everyone wear a mask and be vaccinated that's around them can really significantly reduce the risk for them as well.
Thank you, Dr. EJ. And I just want to give Dr. Woodford she's going to come up in the medical moment, but I know she's got something else she wants to add here in the roundtable. Dr. Woodford.
No, thanks you so much, Yvonne. I agree with all that's been said. And I just want to add that in clinic, I think I see a lot of kids, a lot of families where they're getting tired, right? They've been doing these layers and it's getting a bit exhausting, and they thought they were coming out of it and now we're going back. But I'm like, we live in Michigan. We're used to things changing. We're used to weather changing, right? We see one day it's rain, next day it's sunny, and we have to keep up to date with how the weather's going to change and dress and act accordingly. The same thing is true with coronavirus. This is going to wax and wane, and we have to keep up with it. We can't, it's not that it's all going to go away and it's done. It's going to wax and wane. We have to keep up with the changes and then act accordingly. And unfortunately, right now, we're going into a wave where we are going to have this Delta virus, and we have to bring back all of those layers that we were so good at practicing in the past.
Thank you all for participating in the roundtable. And I know there are so many more questions based upon what you said. We've got a whole list of questions we can answer. So we can ask. So I'm gonna ask our panelists as the questions are coming in the Q&A, please help answer those questions for our participants so that we're responsive to their questions today. So as we look at the Delta variant and the changes, as Dr. Wolford just mentioned, we want to hear the updates from the health department. A lot of activities are going on. And so Sherelle is here to give us that update. And as you come forward, Sherelle, one of the things that you are doing every week is you're showing us this data dashboard that gives an update. So can you emphasize the importance of this data dashboard and what we learned from it? Sherelle.
Good afternoon, everyone. Yes, so on the dashboard, you can see our updates countywide. Right now, about over 327,000 people have received at least one dose of the COVID-19 vaccine. We have about 44.5% of our population fully vaccinated. And you can see down in the corner which vaccine has been distributed and how many. We are continuing to see a rise in vaccinations, and we are hopeful that more people come out to be vaccinated. School is coming back into session, kids are going back to school, and as just previously mentioned, there are those children who cannot receive the vaccine yet. So we want to make sure that we're taking precaution, being proactive, getting our vaccine to protect them as well. So I did just want to point out some of the statistics. Right now in Genesee County, as I mentioned before, 44.5% of the county is fully vaccinated, and 53.4% have received at least one dose of their vaccine. We have seen increases in cases, but in the last 7 days, we went down a few. So we're down to 106 cases for this past week. And we're also seeing our 7-day positivity rate to decrease from 6.9% to about 5.2% on today. However, we are seeing an increase in the hospital's COVID-19 patients who are being hospitalized. So we definitely stress that if you have not been vaccinated, that you get vaccinated, because those who have not received the vaccine are the ones who are going into the hospital and facing more serious side effects from that virus. Next slide, please. So right now we're at Miller Road McDonald's, where you can come and receive any of the 3 vaccines, Pfizer, Moderna, or Johnson & Johnson. We'll be here until 2 p.m. today. We'll also have a clinic later in the day at the University of Michigan Riverbank Park. That will start from 2 to 7 p.m. So if you miss us at McDonald's, we'll be downtown right at University of Michigan Riverbank Park. And then there will be a block party on tomorrow for the Sharp Manor neighborhood. If you're in the area, you can stop by from 1 to 3 p.m. We'll have Pfizer available for 12 and up, as well as Johnson & Johnson for those who only want 1 dose. And on Tuesday, we'll resume at Our Lady of Guadalupe Church, Wednesday, Central Church of the Nazarene, and Thursday at Shiloh Missionary Baptist Church. And then we'll also have some clinics where we're coming to everyone. We'll be at the shelter of Flint, and we'll be at Way Academy as well on Thursday. So you have 3 locations on Thursday that you have the opportunity to be vaccinated. And if you visit our website at gchd.us, all of our clinics are posted with their times and locations throughout the week, weekly. Next slide, please. And we do remind you to continue getting tested. If you feel like you've come in contact with someone with COVID, or just for peace of mind, sites where you can be tested within the community include your local Rite Aid or Walgreens. You can also visit Hamilton Community Health Network or Genesee Community Health Center. And then we have our 3 churches, Word of Life, Bethel United Methodist, as well as Macedonia Baptist Church, who are all offering free testing for COVID. Our urgent cares as well have testing. So there's no reason not to get tested, and there's no reason not to get your vaccine. Next slide. And with that being said, there's no more registration. All vaccine clinics are walk-in. And if you're homebound, you can give us a call at 810-344-4800, or go visit our website to get registered so that we can come out to your home and get you vaccinated to keep you and your family, caregivers, and friends protected.
Thank you so much, Sherelle. And while you're still here, you said you're at McDonald's right now?
Yes, I am. We are outside at McDonald's. There's a tent in the back parking lot. So if you're out and you can stop by, come get vaccinated.
Yeah, so we just wanted people to know that the vaccines are not in the McDonald's, but they're outside, and so they can drive through and get those vaccines. And we had a great panel on with us last week, and they emphasized the fact that there are going to be a number of activities happening for the next few weeks. I know through the first week in September, the health department is going to be available, the Genesee Community Health Center with the mobile unit, and all these opportunities will be available. So if you're not able to get to any of these, please keep track of these sites and listen up, because we'll be telling you more and more throughout the city about these opportunities available for getting the vaccine. As was said, we're seeing more and more young people who are being infected with the virus. And so those of us that are able to get these vaccines, it's important for you to consider, make that decision for yourself. So thank you again, Sherelle, and for the health department being available to help make sure that vaccines are available for all of our community residents. Thank you. As we go forward to the policy brief, while Mary Catherine is preparing, I want to just remind us too, we went through a period of time where vaccines were like sparse, and now they are readily available. So we have some more data that we want to share with you through the policy brief. So Mary Catherine, give us some additional updates on the data that's available for us in our community.
Yeah, great. So first, let me just say, if anyone does have any questions about the data, to just shoot my colleague Rick Sadler an email at sadlerr@msu.edu. And if you have any questions about anything else that's reported in the brief, please shoot me an email at crawf457@msu.edu. So we did see a decrease in the total case counts this week for all of Genesee County. This is hopeful news, but we still remain at a moderate risk for COVID transmission level, as Dr. Hackert said. So this means our weekly case and our positivity rate essentially fall within a specific range. That means all the more reason to follow the new mask recommendations and all the more reason to get a vaccine if you have not done so already. The good news is, to reiterate what Sherelle said, we did see the positivity rate drop for the first time in quite a few weeks, from 7 to about 5%. And then if we actually take a look at cases, take a note that since our last report, we've seen just about a 20% decrease in cases in Genesee County from this week to last week. And we had 101 cases in the county last week and about 80 this week. If you take a look at the health disparities dashboard that we have put together with the Genesee County Health Department and MSU. So again, promising news, but our cases are still higher than they have been in quite some time. So this does not mean we can let our guard down, especially as we make only marginal improvements in our vaccination numbers. So if we take a look at case rates by municipality, it was actually really shocking for me to look at this and see how, some areas in the county have doubled, tripled, quadrupled, while others have actually performed quite well when it comes when you compare rates for June per 100,000 individuals and the rates for July. So this definitely tells us a little something about the Delta variant's transmission and really highlights the importance of our personal and shared responsibilities to get out of this pandemic without any more harm. So with that, I'll kick off right into policy, right? So as Gary mentioned, the governor is planning to invest $100 million into the Michigan Housing and Community Development Fund. And it's really important that local and state policymakers continue to align any investment initiatives with proposals that support housing as vital infrastructure, because this is something our families and communities need to thrive. And Michigan's affordable housing crisis continues to disproportionately impact people of color. So this is a great initiative. We're excited to see how many people benefit from this. And then the other thing I wanted to talk about is the need to really prioritize vaccine mandates in addition to keeping our mask recommendations in place. So by now, we've seen the new recommendations around masks, and it's important because we know that they reduce the chance of breakthrough infections. Dr. Lawrence gave us a great walkthrough of those layers. And I just want people to consider that last piece of Swiss cheese in that model, right? Your thickest and strongest, chunkiest layer of protection. We certainly cannot let masks go, but recall that they did not stop the pandemic before, and they will not alone get us out of it. So I actually would recommend any entity, whether private or public, considering a mask mandate to instead prioritize a COVID vaccine policy, because those are our best defense against infection. And they have a long history in US health policy, from public schools to our military to healthcare facilities. So.
Thank you so much, Mary Catherine, keeping that information available to us. Mandates, this is something that has to happen from the state level and the federal level, but we're thankful that our health officers are encouraging it strongly here in our community. Someone asked a question, and Sherelle was there. Sherelle's at Ballinger and Miller Road with the vaccine clinic right now. So if somebody must be driving that way, so we encourage you to stop off at the Ballinger Miller Road site. Dr. Wolford, one of the things that we know, especially as we continue to listen to the updates for the policy brief, is that data is really important. And we also want to make sure that the data is relevant. So we try to make sure that we tell the story in a way that's helpful for people to understand. So you've done an excellent job at giving us some examples. So we're going to ask you again, give us that for this medical moment. Help us to really understand how this plays in from a data, but also a medical perspective that we can relate to.
Well, thank you so much, Siobhan, for that opportunity to speak about this. Because this Delta variant is sort of a game changer, right? It really has impacted how we can, how we have to operate, what we have to do, and the precautions that we have to take. It really has made it much more important to do all those things. And I want to point out one of the reasons why. So we're going to focus on this issue of how the variant, compared to the original COVID, how the Delta variant is different and why. So if we think to ourselves, the main issue here is the number of people that each sick or really infected person can also infect. Because you don't have to have symptoms to be able to infect somebody else. But how many people can one person who's infected actually infect as they go about their daily activities? So there's a number that we talked about way back last year when we first started having these sessions, that's called the R0 or R0 for some people. And this number describes the number of additional cases that now, we're not sure of the number. It's a bit of an estimate because you can only sort of look backwards and work it out. But we think that for influenza, that every infected person can infect about 1.3 other people. And then we think for COVID and some of the earlier variants that one infected person might infect 2 to 2.7 other people. So if we think about how many people that means, thinking about flu, if we take one person and the 2 people that they infect and then the people they infect, we go down 10 times, we get to 56 additional people who would be affected if you have an R0 of 1.3. But if you have, as we think with COVID, that R0 is 2, then it is exponentially more. If you do just what I said, take the first 2 and then the ones that they infect and then the ones that they infect, and you do that 10 times, rather than being in the 50s, we're now over 2,000. And that is why COVID was so much more of a concern than flu. Okay, so now let's think about the Delta variant. There are some estimates that suggest that it is somewhere between, the R0 is somewhere between 6 and 9. So if we take 6, that is significantly more. So I couldn't show you it on the same slide that I showed you before. So I'm going to try a graph here. So if we do a graph and we look at number of people in the millions on the right-hand side here, you're seeing millions here, and then time along the bottom. So if we start off with like 100 people who are infected and give 10 days for them to infect some more people, and then 10 days later more, and we do that about 6 times out. If they, so with an R for the original COVID, with an R of about 2.7, if you see that little line at the bottom, it means it's, because we're on a scale of millions, it's a few thousand people that will be infected. But if we now have, if it's true, and with COVID, we always have to say that we need more of these things. But if in fact it is an R0 of 6 with this new Delta variant, then over that time, you would see at the end, rather than having several thousand who have been infected, we would have close to 5 million people affected in the same time. So it's just to highlight that the Delta variant is much more contagious than the previous variants that we've seen. And that is why it is so important that we do all the precautions that we talked about. Well, why is it so much more transmissible? And this, we'll have to do a whole nother medical moment on it because it would take even more time. But I just want to point out that people who have original COVID or some of the earlier variants, they would carry that virus in their nose and pharynx area. It's in their body, and it's there in amounts that they can spread it. But when they have the Delta variant of it, the amount of virus that they're carrying is so much more, which is why it is so easy to transmit it. And which is why we need to go ahead and be very careful about wearing our masks, washing our hands, doing all those mitigation things. And so I just want to try, we'll see if this works out here. I want to show you have a little example of COVID, the original COVID spreading, and then the Delta virus spreading. So tell me, Yvonne, if you can really see me, and can you see me full screen? I don't know, I'm hoping you can.
I can see, yes, I can see you full screen.
In here, and we're gonna see that and just see how, this is how COVID spreads, right? You can see it spreading, it's moving there, it's going down the page. This is how the Delta virus spreads. It's much faster, much wider, affecting more people, even though it started out with the same small drop. We, because of this more rapid spread, this much wider spread, we have to be more careful. And that's my message to everyone today. Be careful, because this cloud of Delta virus is going to spread and has spread much more rapidly than the original virus.
Thank you, Dr. Wolford. And one of the last slide you showed with the two images, how the virus was going in the nose and in the mouth, you really gave us a really good understanding of why it's important to have the mask, and the mask covering both the nose and the mouth.
Exactly, exactly. You see people walking around with it on their chin and hanging from their ears, and maybe just over the mouth. It has to cover the whole area. Absolutely.
Thank you so much, Dr. Wolford. And that medical moment was absolutely wonderful, and we're going to keep that information. I think that picture is going to stay with us. But you also give us a good reason to understand the importance of our being able to have healthcare coverage, because one of the things we know as a result, in this conversation we'll have to have at a later time, we're talking about the long-term effects of COVID, which is one of the reasons we want to prevent it. However, people are going to need to understand their healthcare coverage and what it covers and how to utilize it appropriately. So Jim Melanowski is here with us today from the Genesee Health Plan to give us an update on what's available right now for people. In a window is left. So Jim, give us an update from the health plan perspective.
Great, thanks, Yvonne, and thanks for having me follow Dr. Wolford's brilliance. But I'll try to do my best here on this. But yes, and Dr. Reynolds has alluded now for a couple of weeks now about time is running out. And Gary Jones mentioned it in his presentation that the Biden administration extended the open enrollment into healthcare.gov, the Affordable Care Act, till August 15th. So about less than a week, or about a week now, a little bit over a week, we have to get people enrolled into this. It was part of the American Rescue Plan Act of 2021. And it really was to help people either that are currently on the ACA coverage to save some money, or really encourage those who do not have healthcare coverage to get it. And so they could certainly, people can get help by us at the health plan, stop by our office, call. Or again, we have great partners like Hamilton and the Greater Flint Health Coalition that will help with enrollment. Next slide, please. So again, there's been 2 million people who've taken advantage of this special enrollment period that started in February of 2021, and it's been extended. So that's fantastic news, because the numbers of ACA, and I'll show that in a different slide, has gone down recently over the years. And so this has really helped kind of boost that up again. And as Gary mentioned in his presentation, they are considering moving that enrollment period next fall here and into the winter from November 1st to January 15th instead of December 15th, giving people an extra month but more importantly, giving those agencies like ours and others in our community an ability to help and assist more people, because it really does get busy in those 40. It'll also, the proposal also will help consumers with no greater than 150% of FPL to be able to enroll at any time, because a lot of times life changes, and those folks that really need it might have just recently got uninsured, can enroll right away under these new proposals. So we're hoping to hear back from the administration very soon on this. Next slide, please. So again, uninsured adults, that's who, individuals, that's who we're targeting here. Just think about it in our community. If there is anybody walking around, whether they're a child, adult, a senior, that does not have health care, if you're in a conversation or you're at a get together and they say those words, I don't have health care insurance, there is ways of helping them either. And so please have them contact us. No one should not have any healthcare coverage in our community. This is also seasonal workers. We work with a lot of, you talk about back to school, a lot of bus drivers who are seasonal that we assist that might not have healthcare coverage through their district, but we can certainly help them. Those who have lost their coverage, and that's a lot of people in 2020 and 2021 with the pandemic who have. This is a group that's newly eligible for assistance. They might not know anything about Genesee Health Plan or the Medicaid expansion or the Affordable Care Act or Obamacare. These are new things because they've always had coverage. So we need to really keep our eyes and ears open for this group of people. And then those who have already signed up in the past, that we can maybe help them save a little bit more money on their premiums. These are the people that we need to target. Next slide. So again, so new people, they're saying that 4 out of 5 enrollees may get a plan for $10 a month or less. So that's something that's affordable. We always talked about the Affordable Care Act not being affordable. Well, this brings it affordable. Next slide, please. And then those who have signed up already could see a lowerage of their premiums or a lower in the tax credits that they, or an increase, I'm sorry, in the tax credits that they might receive. Next slide, please. A success. We talked about this last time I talked, that this is actually working. People, one person that re-enrolled, they saw tax credits increase by $114. That's almost $1,200 a year. Someone else resubmitted their application, received $70 per month increase in their tax credits. And then, so this is actually really working. It's good to be able to say that for a change, that something's working that's supposed to be working. So we're real excited about working on it on our end. And we just need to get more people contacted and involved and have more knowledge in that. Next slide, please. And so we can do this over the phone. We can do it virtually. We have a virtual platform. You see, we have those other partners in our community that can help with this enrollment. So really, we've really taken down the barriers on this and made it as easy as we can. So please encourage people, if they say those words, I do not have healthcare insurance, get them to us, get them to our partners, and we can assist. Next slide, please. You can see that trend previously had been going down in our state. And so we're going to see a reversal of that more people are getting enrolled, but we know that there's others out there that need our assistance. Next slide, please. So those are the ways to contact. I just mentioned, as you were introducing me, Yvonne, you and I have been meeting with some community partners who work with members of the community. And they say two things, that so there are people out there that do not have health insurance and healthcare coverage, and they need help and assistance to get them enrolled. But they also talk about people who have coverage, but they don't know anything about what their coverage is and what it covers and how to access it. And so that's really the most important message, other than no one should not have any, be walking around without any healthcare coverage, is we need to do a better job of educating people on what their health benefits are, and then how to use them and encourage and motivate them to use them. Because you're right, Yvonne, we're in this next phase where we need to make sure people are at their healthiest in order to combat COVID, combat the flu, combat any other pandemic that comes down the road. And we need to make sure people are doing those preventative services, and so that they're maintaining their health and have a relationship with a doctor so that they can combat all these diseases that are out there. So I'm gonna stop right there.
Thank you, Jim. And you're absolutely correct. We use this phrase sometimes. We say, get it, keep it, use it.
Right.
And one of the things that is really, really important is our health. Our best defense of many of these situations is keeping and maintaining good health, improving our own immune system, and having healthcare coverage so you can go to the doctor and get that assistance is really important. So encouraging primary care for everybody in our community. So thank you so much for the work you're doing. And I know it's been 20 years, Health Plan's been doing this business. And so the staff is well poised to continue to help with that. You also mentioned earned income tax credits. Next week, just as a heads up, we're going to be talking about that because there's some confusion with what's available through earned income tax credits and child tax credits. And we talk about all of these things because as a result of the coronavirus, as you can see with some of the legislation, there have been some opportunities to increase eligibility. So please continue to share with community members not to be dismayed, even though there is a lot to be dismayed about. There are rays of hope that we hope to encourage you to understand. So one of those rays of hope is understanding what's going on in the city of Flint. We've got a lot happening, and Lottie Ferguson is here. We've had questions about the water, and we're continuing to talk about the infrastructure. What are we going to do to reduce crime in our community? So Lottie, give us an update of some of the rays of hope that's happening here in the city of Flint.
Well, good afternoon. This morning, I wanted to be sure to talk with you about the secondary water pipeline connection that you may have heard about in the news lately. The secondary water pipeline is going to provide a safe and reliable backup source of water in the case of an emergency. This is one of 8 infrastructure upgrades that the EPA required of the city of Flint. It's about $17 million. That's the cost for this project, and it is paid for with federal funds. The 7-mile water pipeline will connect Flint, the Flint system, to the Genesee County water system. And it's expected to be ready actually, if not now, in just a couple of days. So the secondary water pipeline will create a connection between the Flint water system and the Genesee County Drain Commission's water system. And to keep water fresh and safe, a small amount of water, about 5% in the total Flint water system will always run through the pipeline. So what this means is that if we ever have another emergency, we will never, ever have to use Flint River as a source for water because we'll have a backup pipeline to Lake Huron. So it's the exact same source. It is just a secondary water pipeline for emergency backup use. So these upgrades also include renovation of Control Station 2 to make that a state-of-the-art water distribution system. And so you need to understand that the water quality is tested continuously at the water plant and in 5 other locations in the city of Flint. If you are experiencing any problems with the quality of your water, 24-hour water emergency contact is 810-766-7202. And if you want an update on what the water quality is at the moment, you can visit the City of Flint's website and check out our progress report on Flint water. If you've got questions, please feel free to drop them in the chat. I'm happy to answer them. But this is, again, a project that we knew was coming. Is one of 8 infrastructure projects that are required in the city of Flint. And we're excited to have a secondary backup source coming to us very soon.
Thank you so much, Lottie. A lot going on. So I know people are saying what's happening in the streets. And so the work to make sure that we do have safe water is still underway. So thank you for that. I'm going to ask our panelists again, there's some questions in the Q&A. If you would take a moment to answer some of those for us, we would appreciate it. We want to now go to Dr. Lawrence Reynolds. He's a chief health advisor for the city of Flint, but he's also a retired physician, pediatrician. And many times he's given us this global view of everything. And so, Dr. Reynolds, I do have a question for you that was asked, and you have answered it partially for us before in another conversation. But many people are asking about the vaccine. It's under emergency use authorization right now and looking to be approved by the FDA formally shortly. And I would like for you to talk to us a little bit about that, and if you can connect it to the health coverage conversation.
Oh, yes. Emergency use authorization is a temporary emergency measure to address a pandemic, something like a pandemic. So the was approved without full FDA approval because they met most of the process. The step that will be required next will be for the FDA and a panel of experts to sit down and go over the data, and based on the experience with all the testing, you've heard us talk about 1, 2, 3, and 4 levels of testing, and 4 is when it's moved out to the general population. Those things have been done to address the emergency. We have the data, and when I say we, the FDA and the CDC has the data to examine, then they will talk about final FDA approval. Like typical vaccines came out under non-pandemic situations. And I keep saying pandemic because we should never forget, we are still in the middle of a pandemic, and the government will do things differently, and we must respond accordingly. Okay, so, and then there's the next part of this. As long as an emergency has been declared, the cost of vaccine is covered. So you may ask the question, well, then why do I need to show my insurance card? Because it means it's covered and there will be no charge to the individual. But the office, the health department, or whoever gives you that vaccine will be able to charge what they call an administration fee to your insurance company, not to you. Okay, so no one should be asking you for money. And if they do, especially if you're on Medicare, you can call this number, the Medicare hotline, 1-800-Medicare. That's 1-800-633-4227 to report the charge. And if Medicare actually pays the provider or the doctor's office or the clinic for giving the vaccine, the beneficiary, that's you who got vaccinated, and who paid, would be entitled to a refund. The vaccine is covered by Medicare. The vaccine is covered by Medicaid in this state, thankfully. Now, there are some modified Medicaid plans where you may not be covered entirely, but that is not the case. Okay, if you have a problem, you call your insurer or you call Genesee Health Systems to help you troubleshoot through this issue. And notice, you know, I am a physician, but I don't know all the ins and outs of billing. We actually have billing specialists, and then we have people who compare plans, which is a whole separate category. So if you have a question, ask the question. And I always recommend go to Genesee Health System. You can call Hamilton. You can call your plan. And if you're not satisfied, call someone else. Okay. And Jim Malinowski reminded us that the vaccine is covered by the Genesee Health Plan, which I will remind you all is funded by the residents of Genesee County, because we look out for each other. And
Okay.
so that should cover it.
Yes, sir.
It was
Thank you,
done by
Doc.
law.
I'm going to ask you, Dr. Reynolds, come back next week because you have some great information to share. And our time is up for today. We thank all of our listeners for coming. Appreciate you so much, Dr. Reynolds. Hope we got that number. But we want you to know we need you to continue to help us by sharing your insights, your questions. This helps us to make sure that we're responding to your questions appropriately. I thank all of the panelists for joining us today. I want to ask our community health workers and the social workers continue to apply for those continuing education units or those social work credits based upon your area of expertise and employment. We want to thank you again for liking us on Facebook. I'm saying ahead of time, you've liked us on Facebook. You've subscribed to our YouTube channel, Healthy Flint. And of course, you can give us a call at 810-835-2130 for more information or questions that you need to have answered. We look forward to having you come back next week and join us. More information to come, more questions will be answered. And again, as always, take this information and share it with someone else in your community. This is how we'll make a difference. Thank you for joining us, and we'll look to see you again next week.